Sure. Hello, good morning. So today we are discussing the another aspect of neoplasia. Yesterday we discussed general aspects of neoplasia. So today we are discussing about what is differentiation. So differentiation is extent to which parenchymal cells resemble to the normal cells. If a tumor may be a well differentiated or poorly differentiated. What do you mean by well differentiated? When neoplastic cell resembling the mature normal cells of the tissue of origin. In poorly differentiated or undifferentiated type of tumors, that there is a primitive appearing unspecialized cells. So you cannot say that this is resembling to the mature or normal cell. So examples of differentiation: benign tumors are a well differentiated type of tumors. The commonest example is leiomyoma of the uterus, which is a tumor arising from the smooth muscle cell. So this is a example of a benign, well differentiated type of tumor. While the malignant tumors or neoplasia, they range from well differentiated to the undifferentiated. So lack of differentiation or anaplasia is considered as it is a feature of malignant transformation of the tumor. What are the features of lack of differentiation? What you will find in the when there is a lack of differentiation, most important is a pleomorphism. It means there is a variation in size and shape of the cell and the nuclei. Thus, cells within the same tumors are not uniform but range from large cells. Many a time they are larger than their neighbors, or they may be extremely small and primitive appearing. So when you say that specific tumor shows a pleomorphism, it means there is a marked variation in size and on shape of the cell as well as the nuclei. And this is one of the important feature of lack of differentiation of tumor. Second is a abnormal nuclear morphology. Characteristically, the nuclei, they contain abundant chromatin and they are dark staining, so known as a hyperchromatism. So this is one of the feature of abnormal nuclear morphology. Nuclei, many times they are disproportionately large for the cell, and the nuclear cytoplasmic ratio increased. In a normal cell or in a benign cell, the nuclei, they are in comparison to the cytoplasm, there is a usually a ratio of 1:3, means nucleus is 1 and cytoplasm is 3 times. But in a malignant cells, this ratio is changed and nuclei, they are large, and many a times there is a reversal of nuclear cytoplasmic ratio, means nuclei occupy about the 2/3 part of the cell and 1/3 is the cytoplasm. So nuclear cytoplasmic ratio, this may be 1:1. It normal ratio may be 1:4, or I say 1:6, but normal is about 1:3. So in comparison to this, this nuclear cytoplasmic ratio is changed. And second, what is the feature is the nuclear shape is often irregular, and chromatin is coarsely clumped and disrupted along the nuclear membrane. And many a times, large nuclei are also present in these nuclei. So, in the uh, differentiation of the tumor, I told you that most important take place a feature is pleomorphism, and the pleomorphism is in the size and shape of the cell, and then the nucleus, and then what is the nucleus? Nucleus is large in size, nuclear cytoplasmic ratio is reverse, and many a time there's a just uh, more increase in the nuclear size, and nuclear membrane is irregular. Then another feature of lack of differentiation which can be measured is by mitosis. So there is an increased mitosis. It reflects that is a higher proliferatory activity of the parenchymal cells. So malignant and undifferentiated tumor cells usually possess large number of mitosis. So mitotic figure increase is a feature of the anaplasia or lack of differentiation. However, the presence of mitosis does not necessarily mean that tumor is malignant or the tissue is neoplastic, because mitotic activity in the normal range is found in the dividing cell, but increase of mitosis is a atypical feature. So more important feature of malignancy are atypical bizarre mitotic figures, sometimes producing tripolar, quadripolar, or multipolar forms of mitosis. As I told you that just the increased number of mitosis, you cannot label some cell that this is a malignant or neoplastic cell. So what are the conditions in which you will find normally increased mitosis? So many normal tissue exhibiting rapid turnover, for example, bone marrow, have a numerous mitosis, but these mitosis are not abnormal. And second example is that non-neoplastic proliferation. In that also you will find increased mitosis, but that is you will find in hyperplasia, where you will find more mitotic figures, but these cells are not malignant. Then next feature which can be taken for a measure of uh, poor differentiation or measure of neoplastic change in the cell is loss of polarity. So in cells, normally they are arranged in layers, and but if there is a loss of polarity, means sheets or large masses of tumor cells grow in a disorganized or anarchic fashion. So this is one of the important feature of malignancy. These are the common features which you will observe in the malignancy, but sometimes you will find that there is a formation of tumor giant cells, some possessing only a single huge polymorphic nucleus, while others have two or more large hyperchromatic nuclei. So this is a not a common feature, but many a time you will find in some tumor there is a formation of tumor giant cells. Necrosis. Necrosis is also one of the important feature of malignancy. Often the vascular stroma is scanty and many anaplastic tumors have large central areas undergoing ischemic necrosis. So, necrosis may be many a time you will find in a feature of as a malignancy. There are long list of tumors which are or conditions which are pre-neoplastic. They are more prone to develop into a neoplasia. Commonest example is Down syndrome, in which this can convert into a acute myeloid leukemia. Xeroderma pigmentosa, this can convert into the squamous carcinoma of the skin. Gastric atrophy, this can convert into the gastric cancer. Actinic dermatitis is again squamous carcinoma of the skin. Cirrhosis of the liver is a pure neoplastic condition which can convert into a hepatocellular carcinoma. Ulcerative colitis, this can develop into a colon carcinoma. Paget disease of the bone, this can convert into osteosarcoma. So what do you mean by pre-neoplastic condition? Means these conditions, they may convert into a full-fledged neoplasia. That is why they are known as a pre-neoplastic conditions. Means there are more chances that if the stimulus is continued, then this can convert to a full-fledged a neoplastic disease. What are the causes which can lead to the development of the cancers? They are also known as the carcinogens, means the conditions or uh, stimulus or the factors which can help or which can promote or which can lead to the development of the cancers. So one of the most important group of this carcinogen is chemical carcinogen, and this process is known as a chemical carcinogenesis. So these are work as a mutagens, and these chemical carcinogens and their chemicals and their metabolites, they help in the or they promote the development of the cancer. Then second group of carcinogen is physical carcinogen or physical carcinogenesis. In this group, the ultraviolet radiation, asbestos, or these are the conditions which can the second group which can lead to the development of carcinogenesis. Then third group of the carcinogen or factor which lead to development of cancer is infectious pathogens, usually the viral, human T-cell leukemia virus, DNA virus, human papilloma virus, Epstein-Barr virus, hepatitis B virus. These are the some viruses which can lead to the development of the cancer. So, what is the epidemiology of malignancy? Epidemiology means what are the various other factors which can promote or which are more prone to develop the carcinogens. For example, one of the most important factor is smoking. Smoking and the lung cancer. So there is a great correlation that the smoking is found to be associated or responsible for development of lung cancer. And this smoking is found not only in the lung cancer, but it is more prone to found in the development of cancer of the mouth, pharynx, larynx, esophagus, pancreas, bladder, and most significantly that about 90% of lung cancer death, they are found to be associated with the history of smoking. हेलो, हाँ बोलो, गुड मॉर्निंग। हाँ, कहाँ होना है? ठीक है, थैंक यू। Second is high dietary fat and low fiber is more lead to the development of colonic cancer. Alcohol is act as a carcinogen in cases of carcinoma of oropharynx, larynx, esophagus, and hepatocellular carcinoma. So history of taking alcohol is alcohol abuse. This can lead to the development of these cancers. Alcohol and tobacco together increases the danger of occurring cancers in the upper aerodigestive tract. Other factors which were found to be implicated or associated with the development of cancer is obesity. They say about 14% of cancer death in men and 20% in women is associated to be a history of obesity. Then there are environmental factors, some racial, possibly hereditary, and there are also some cultural influences which lead to the occurrence of specific type of the cancer. The risk of cervical cancer. It was found that in epidemiology of study of cervical cancer that there are some factors which found to be associated with increased incidence of cervical cancer is age at first intercourse. So early age of marriage or age at first intercourse, if found to be more associated with the cancer of the cervix. If there is a history of multiple number of sex partners, then there is also increase of the cervical cancer. And now it is also known that if there is a history of any transmitted venereal disease, human papillomavirus, this leads to the cervical dysplasia, and ultimately this leads to the development of cervical cancer. Age has an important influence on development of likelihood of developing cancer. They say that most of the cancers, they occur in the later period of life, that is usually after 50 or 55 years of age. So the increasing age has a important fact on the development of cancer. Cancer is the most important cause of death in the woman between 40 to 79 years of age, and in man about 60 to 79 years of age. So decline, again there is a decline in the death after age of 80 is due to the large number of individuals who reach this age, that there is a decreased incidence of the cancer. Carcinoma is the most common general category of tumor in adults, while this incidence is less in comparison to the adults and the children. While acute leukemia and primitive neoplasm of the central nervous system are responsible about 60% of childhood cancer death. So in the childhood, if there is a incidence of cancer, then 60% of these cancers, they are either because of acute leukemia or primitive neoplasia. The common neoplasia of infancy and the childhood are neuroblastoma, Wilms tumor, retinoblastoma, acute leukemia, and rhabdomyosarcoma. These common childhood or infancy tumors, they are also known as under a common group, small round new cell tumors. So after discussing the epidemiological aspect of cancer, we will discuss about the etiological agents of carcinogenesis. As I told you, there are three groups of carcinogens: chemical, physical, and infective. So today we will discuss about the now we will discuss about the chemical carcinogenesis. These chemical carcinogens, either they act as a directly acting carcinogens or they are procarcinogens, means they needs activation to become carcinogen. So directly acting carcinogens is most important is alkylating agents or cyclophosphamide. They act as a directly chemical carcinogen. While in procarcinogen group, which needs activation, is polycyclic hydrocarbon, benzypyrene, aromatic amines, dyes, for example, benzidine, or natural products, they are aflatoxin or vinyl chloride or turpentine oxide. They act as a procarcinogen. When they are activated, they act as a chemical carcinogen. So procarcinogen is a stable if they are detoxified, they exit metabolite, or if they are activated, ultimately they become reactive electrophile and they bind to the DNA. They lead to the development of the mutation and the cell, and because of the mutation in the cell, this lead to the malignant transformation. So this is how procarcinogen they lead to the ultimately development of the cancer. So carcinogen, either they are detoxified and they are excreted, or they need metabolic activation, electrophilic intermediates, they bind to the DNA, and they if this DNA is repaired, then cell becomes the normal and maybe a cell death. But if this binding, there is a permanent DNA lesion, there is an initiation in the cell, that will lead to the cell proliferation, altered differentiation, and this leads to the pre-neoplastic clone. And on the promotion of the pre-neoplastic condition, there is a proliferation and ultimately there is a malignant neoplasm formation. Second group of carcinogen is a virus. A virus that can cause cancer is known as an oncovirus. So this includes the commonest oncovirus which developed is carcinoma cervix, commonest is human papillomavirus. Second group of virus is Epstein-Barr virus. This Epstein-Barr virus is this leads to the development of beta cell lymphoproliferative disease or nasopharyngeal carcinoma. Other uh, uh, cancers which develop due to the viruses are Kaposi sarcoma because of the herpes virus, or this may be in HIV, is there a development of Kaposi sarcoma, hepatitis B, and hepatitis C viruses. They lead to the development of hepatocellular carcinoma. And human T cell leukemia virus, this leads to the T cell leukemia. Sometimes bacterial infection may also increase the risk of cancer. The commonest example is Helicobacter pylori. If this Helicobacter pylori infection is not treated properly, or not treated completely, then this may induce the gastric carcinoma. Some parasitic infestation, they are also found to be strongly associated with the cancer, and the common parasitic infestation is Schistosomia hematobium. This is found to be associated with bladder cancer. So Schistosomia hematobium, this leads to the squamous cell carcinoma of the bladder, and the liver flukes. This leads to the development of cholangiocarcinoma. So these two parasites are schistosome and liver flukes. This can lead to this type of cancer. Third group, after this chemical carcinogen and infections, this is by viruses or parasite or bacteria. Third group is a radiation carcinogenic. This is one of the most important group which leads to the development of a cancer. So radiant energy, whether it is in the form of UV rays of sunlight or an ionizing radiation, this leads to the electromagnetic and particulate radiation. This can transform virtually all cell types into the neoplasia. So UV light is closely found to be associated in the causation of skin cancer, especially in the white skin peoples. This UV light is found to be in development of skin cancer, mainly the basal cell carcinoma many times. Ionizing radiation exposure, either it is from the medical or because of the occupational hazards, exposure, nuclear plant accident, and atomic bomb detonations have produced a variety of forms of malignant neoplasia. So persons who are working in the X-ray departments, or who are prone for ionizing radiation, or because of their occupation they are bound to expose, or if there is sometime an accident in the nuclear plants or atomic bomb. The most common example of atomic bomb explosion leads to development of cancer is Hiroshima and Nagasaki, where after this atomic bomb explosion, there was increased incidence of so many types of cancers. Source of ionizing radiation includes medical imaging and radon gas, non-ionizing radiation from ultraviolet radiation. Leukemias are developed and they require around 2 to 10 years to appear. Some people, such as those who develop with nevoid basal cell carcinoma syndrome or retinoblastoma, they are more susceptible than an average person to develop a cancer from radiation exposure. So how this development of cancer takes place? There is a changes in DNA that is known as a mutation, and this change must cause an alteration in cell growth and behavior. Then change must be non-lethal, and this should be passed into the daughter cells. and alteration is more than one gene, and gene concerns are known as an oncogene, or there may be a change in the tumor suppressor genes. So sequence of genes alteration from normal to benign to malignant, and this intrinsic and extrinsic inheritance and environments, these are the key factors in the developments of cancer. So what is the molecular basis of carcinogenesis? Cancer is a genetic disease. Genetic injury is may be inherited in the germline or it may be acquired in somatic cells, and these tumors are monoclonal, progeny of a single genetically altered progenitor cell. Carcinogenesis or oncogenesis means there is a mechanism of induction of tumors, how these tumors they are introduced. So literature on the molecular basis of cancer continues to increase at such a rapid rate that you can easily get lost in the growing forest of this information. So this is day by day, there is a increasing literature, increase in the knowledge of molecular basis of development of the cancer.